Hello, my name is Nicole, and I'm going to be performing a focused postpartum assessment. And do you consent to this assessment?
I do.
Okay, awesome. Okay, so I'm outside the patient's room. I'm confirming the doctor's orders to do a focused postpartum assessment, performing hand hygiene, gathering any necessary equipment, stethoscope, and then, okay, knock on the door. Knock, knock.
Come on in.
Okay, hello. My name is Nicole. I'm going to be your nurse today. How are you feeling?
I'm good.
Okay. Can you confirm your name and date of birth for me, please?
Colleen Bennett, 12/18/92.
Okay, awesome. And then I'm also going to scan the room for any safety hazards, anything like that. I'm going to perform hand hygiene again and don some gloves, and then close the curtain to provide privacy for my patient. And then, can you please tell me about your birth and how that went?
Yep, so it was a vaginal birth
Okay.
at 40 weeks.
40 weeks, okay. And then, did you tear anything like that?
No.
Okay, awesome. That's good. Okay. And then, is this your first child?
It is.
Okay, awesome. And then, I'm going to go ahead and start by getting some vitals on the patient. I'm going to go ahead and get her temperature, respiration, pulse, blood pressure, pulse ox. Are you feeling any pain or anything like that?
No, not too bad today.
Okay. And then, do you plan on breastfeeding or bottle feeding?
Bottle feeding.
Bottle feeding, okay. And then, since you're bottle feeding, I'm not going to go ahead and touch your breast. We want to avoid any sort of stimulation. So even that goes to your partner and yourself, if you can try to avoid touching it for at least the next week or so. Even in the shower, warm water will stimulate it as well. So if you can also wear some sports bra or compression type bras, that'll help decrease milk production as well. Okay, awesome. And then if you are breastfeeding, I would check to see if she has any cracks in her nipples, any bleeding, trauma, anything like that. I would see if she was engorged, if there's any redness, swelling, if it was warm to the touch, because then that could be a sign of mastitis as well. Would you mind laying down so I can go ahead and check the uterus, please?
Thank you.
Okay. And then so, with my non-dominant hand, I'm going to hold on the patient's, for the patient's pubis symphysis, and then with up here, I'm going to run her belly button, umbilicus, feel that it's firm and midline, her fundus. Okay. Then it's midline, it feels firm, so that means that her uterus is contracting. So I'm not worried about the patient hemorrhaging, anything like that. I would also next, while I'm down here, I would check the patient's perineum area to see if there's any redness, how's her drainage, if there's any swelling, ecchymosis, any excessive bleeding, anything like that. And since she didn't tear, I'm not worried really about approximation. And yes, you can sit on down. And then when did you last change your pad?
Just 3 hours ago.
3 hours ago? Okay. And then how would you describe the amount of blood for 3 hours? Was it really heavy and soaked, or was it like kind of moderate?
It's red and moderate.
Okay. And then at this stage, since this patient is just less than a day postpartum, I would expect rubra for her blood, so bright red, and that typically lasts for about the first day before it moves into serous bleeding, so more of a lighter pink, and that's typically what it will stay for until the patient leaves the hospital. And then after leaving the hospital, it'll turn more into an alba color, so a lot more clear and less blood. Okay, and then let me see. We'll next assess the patient for any blood clots or any DVT. So have you noticed any swelling or redness in your legs?
No.
No. And I don't notice any swelling, anything like that. I would lift the patient up and see and feel for any edema. And since she's not having any pain or anything, I'm not really worried about her having any sort of thrombosis go on. And then How do you feel emotionally since giving birth?
Pretty good. I
Pretty
feel
good?
very attached to this baby. I love her very much.
Well, that's good to hear. And then I would observe this as well, just as passing by the patient's room and going inside to see if she is tending to her baby and if she's holding her baby and connecting, making eye contact, you know, just the normal kind of connection type things, or maybe some skin to skin. And then so you're not feeling any kind of postpartum blues or any sadness or
Nope, I don't think
I know
so.
it's a big change. Okay, good. And then, do you know if you were RH positive or not?
I was.
You were, okay. So since the patient is RH positive, then I wouldn't worry about giving the RhoGAM shot, which, if she was negative, then it would be given within 72 hours of her giving birth. And, before I leave, do you have anything else for me to get for you, or any questions about anything?
I haven't had a bowel movement. Is that okay?
Thank you for letting me know about that. Have you felt the urge to push or anything, or?
No, not really.
No?
Not yet.
Okay. I'll go ahead and talk with the doctor and see about maybe getting a stool softener to see about helping you, because although it's not mandatory before discharge, we do want to see, start voiding and pushing. Have you voided at all since?
Yes, that's
Okay.
fine.
That's good. Okay, thank you.